This is a podcast where real doctors discuss fake medical emergencies. That means that unless you're a leaf on the wind, this podcast is not medical advice. If you need medical advice or medical care, please contact your doctor. Also, just as a heads up, there's a minor spoiler for episode 5 of season 1 of WandaVision in this episode. It's not a huge plot point or anything, but just be aware.
Hi, everybody. I'm Jackson Bain.
I'm Johnny Kolosinski. You might remember me from such podcasts as Raver Reading Parties, a Firefly fan fiction review.
Boo.
This is Hi Everybody, a Bad Medicine podcast. Every week we talk about what Hollywood gets right and wrong about medicine and how the body works. You can find this podcast online on Facebook, Instagram, and Twitter at HiEverybodyMD.com or by visiting www.HiEverybodyMD.com on the World Wide Web.
But if you hate the World Wide Web and you want to talk to us via telephone, call us at 530-DOCTORB. That is 530-DOCTORB. The B stands for body snatching.
And why does the B stand for body snatching?
I think you know why. You're the one who picked this show.
I did. It's a rare time where I'm the one who picked what we're talking about rather than, someone who's qualified. We are talking about episodes 1 and 2 of Resident Alien, the new show on Syfy, starring Alan Tudyk from Firefly and iRobot and the chicken from Moana.
Wait, he was the chicken in Moana?
He was the chicken in Moana.
I did not know that.
Yeah.
I mean, he's like such a bit actor. Mm-hmm. And then now it makes sense, but he definitely is one of those weird character actors in general.
Between him and Paul Bettany from WandaVision, the remaining cast of A Knight's Tale is having a good month.
Who else is having a good month?
Paul Bettany was Chaucer in Knight's Tale.
Oh, you're right. Who's the other one? Shoshana Sossaman or Shan Sossaman? The maiden.
Yeah.
Your face, I know this is an audio medium. Your face describes why I don't know if everyone in the Knight's Tale had a good time.
No, but a couple of them.
Yeah, I would say so. But WandaVision, good show. Kind of like Midsummer. You should probably watch it. But this show,
I really like it.
I know you really like it. I'm confused by it still. And I was trying to watch it from doctor eyes and not general sci-fi eyes.
Not goofy eyes.
Yeah, like the alien in this whole thing? Yeah. I was not watching it from that.
So the plot of the series is that Alan Tudyk plays an alien whose spaceship crashed on his way to destroy Earth, and he has to find his death bomb. And in order to do that, he's taken over the body of a doctor in a small Colorado town. And that doctor is just, was there for a fishing trip, and then it was stuck around. Alien Alan Tudyk played it as he'd retired.
Yeah.
But in actuality, it was so that he could find those alien pieces, the pieces of his ship. And all was going okay until the town doctor died.
Yeah.
And he was brought in to do the autopsy.
Which is an odd thing to have a random doctor that you just found do an autopsy. Mm-hmm. Like, I don't know what his background was. Like the original doctor, like
the original
Harry,
doctor.
Original
they
Harry.
Talk about it. Harry Redinger,
Van something. I don't know.
Yeah, they brought it up in the 2 episodes that we watched. That he has a clinical psychologist background, and then he was head of the virology lab or something along those lines at Rutgers.
Yeah, and I wrote that in big gigantic letters. What? I mean, so clinical psychology is a very different thing than medical psychiatry. Mm-hmm. Quite different. Like, so psychologists.
Maybe it was probably clinical psychiatrist, and I probably
no. They said clinical psychology. I wrote it down specifically that way. So, a clinical psychologist is your PhDs in psychology or masters in psychology, and kind of do your standard thing that you always see where they sit and talk and whatnot. But psychiatrists are the ones that go to medical school
prescribe your meds.
And they prescribe your medications. So those are 2 very different things. And the crossover into virology is a very weird thing too, because again, that's more of a bench science kind of situation and not so much like infectious disease, which is a medical field.
Mm-hmm. And we've talked about that a little bit when we talked about Code Black, and the switching those specialties to that degree is really not a thing.
Well, this is not so much even switching a degree. This is almost like we're impersonating a doctor, right? Because when you get licensed by whatever state you live in to work, you have to have like a specific license. And case in point, like my license in California is a very specific physician and surgeon license, not a clinical psychologist license or something like that. So you can't even be licensed to work if you don't have the right degree to do so. So that's like a big no-no in the whole thing.
Okay. So the big red flag beyond wires. I mean, okay, this is literally the one doctor in town, so they're bringing him in. But if he's working at Rutgers in New Jersey, he's not going to be licensed to practice in Colorado, even on dead people.
Yeah. And also, I would not send a random person in to sniff and go, that person's dead, which is what I think that was the first doctoring scene we saw him do, right? The alien Harry was that he just went up to someone and sniffed them and said, yep, you're dead.
They've been dead for 6 hours based on the smell, and then they woke up.
Which you can't really tell how long someone's been dead for by sniff. It's impossible. You can't. It's really hard to tell with that precise time how long someone's been dead for. It's just like trying to age a bruise, you know? It's really hard to do so. You can get relative time frames based on like lividities or where the blood's pooling or the color or rigor mortis and all that stuff, which will give you a sense of how long they've been dead for, but not like to the note, like how he just did.
So same problem that you would have then with CSI of they're not going to pinpoint this murder happened within this 20-minute period because of the coloration of the bugs on the left butt cheek.
Exactly. It's impossible. I'm surprised we haven't done CSI yet.
On the list.
Yeah, that show's totally left my mind. But I guess we can talk about just the general overarching theme of this show, like the one case, I guess, and then we'll break down the other stuff. But it's all due to why Harry got pulled into basically this whole situation, right? So Sam Hodges, who is the town doctor, is now dead. Yeah.
And he was found dead with his throat cut and the scalpel in his hand.
The scalpel was in his neck.
Oh, it was in his neck. You're right. Yeah.
But Harry correctly deduced that, hey, it was a self-inflicted wound because he stabbed it directly into his throat. Not so much his neck, but his airway in general. And that was shadowed, it was kind of mentioned that it was probably suicide because of the angle of the cut, and it's all in the front of the neck. And he said any good doctor who wanted to commit suicide would slice their carotid.
And
I don't condone suicide. That's not a painless way to go. He would have probably made deeper cuts too. And I wrote down to not enough blood because, again, whenever you do a tracheotomy of some sort, there's a lot of blood. So they kind of, I'm jumping around a lot here, but they kind of he deduced that he died because he was trying to breathe. Or he stabbed himself in the neck because he was trying to breathe by giving himself a tracheotomy.
Right.
No.
No.
Bad. All of it. Bad.
So what's the first problem?
Well, let's break down why you need a tracheotomy. So the reason why is your vocal cords are closed and they're not opening up. And your vocal cords kind of, think of it like a gate that controls air going in and out of your trachea, right? So if that is occluded, you need to cut below it to open up the airway. But if he's worried he's being poisoned and can't breathe, there's other reasons why that doesn't work, which means the poison could be binding with oxygen or like hemoglobin and not allowing oxygen to transport, so you have that sensation of choking. His muscles might be paralyzed, so even if he cuts a hole in his throat, if his lungs aren't moving, or his diaphragm, is not moving and expanding his lungs, he's not going to move air in. So that's not going to help either. Is he having an acute allergic reaction for something? He'd have clamping down of airways, but also he'd have other symptoms too, like his blood pressure will drop because all of his blood vessels dilate all at once. So there's a lot of reasons why this wouldn't work well. Also, it's super bloody.
And the
Like
room that he was in was not.
Correct. And I guess a good visual representation of this would be, remember in the first season of Game of Thrones when they were doing the joust, and then I think the joust went through, or the sword,
the mountain joust, it was jousting with someone,
and it went through his neck, and then you saw like gurgling bubbles and whatnot.
Mm-hmm.
That's what you would expect to see, especially if you were trying to work on someone who was actively trying to breathe and move air, and then they stab themselves in the neck. You'd actually see some bubbling a little bit, some boublage.
My interpretation of it wasn't that he knew he was poisoned, but that he thought he was choking or had an allergic reaction.
Yeah, but you're also in a clinic, so you would think maybe you have an EpiPen nearby.
True.
Right? There's so many other reasons that he should be doing that to help himself breathe. Or there's many other reasons he should be doing to help himself breathe better.
Other things he could do?
Correct. But then they ultimately do an autopsy on him, right?
Mm-hmm.
So part of an autopsy is that you have to draw blood to do a toxicology panel, which would have ended the whole show right there. 100%, right? Because by the end of the episode, he goes, "Oh, he got poisoned." But if you're doing an autopsy, part of the autopsy itself is making sure there's no random toxins or things that don't belong in the body.
Even if it's something as simple as a bee sting.
That's a little tougher.
And like having an allergic reaction to a bee sting would be something that would show up, though.
Not necessarily, but you would actually see their blood. You'd see other signs like lip swelling, inflammation, all that other stuff. I think the bigger thing is I'm guessing it's going to be some kind of weird poison, and you should have detected that. But they were really cavalier about draining his blood, too.
Yeah, they drained it into a bucket.
Which is not something that happens during autopsies, really. Also, where's that blood coming from?
Like, why is it not coagulated?
Well, not just that, but where is it coming from? Like, did they hook up an IV into their veins to drain out all the blood?
Are they hanging him upside down by his feet?
Yeah, exactly. So, like, it's kind of like when you do surgery on someone's abdomen. You cut them open, they're not going to bleed everywhere because the abdomen usually should not have blood in its cavity. So there shouldn't be that much blood going on. Also, there's no heart pumping.
Right.
So when you make cuts like that, you shouldn't have blood anyways, too. So other things to think about on that autopsy scene. But yeah, and I also agree with you. That blood was not clotting, but also it was really bright.
Yeah, it looked like blood.
Yeah, it looked like fresh blood, not like old, I've been dead for a while blood. So yeah, there was a lot of weird, I don't know, that whole, that whole scene was weird. And then the final thing I wrote down was the brain was the appropriate amount of squishy.
Oh.
Yeah. So a fresh brain is actually pretty soft and mushy. I know when you think of brains that are taken out of heads, you always think of like this firmer jello kind of situation, like a harder jello, right? No, it's like jelly.
Oh, wow.
Yeah. So the reason why the brain usually gets really firm like that is usually fixed with formaldehyde or something like that. So that's why you would see it like nice and hard and sometimes gray. Again, though, that brain is a little too pink. Usually you'd expect it to be a little more pale. As a guy who's seen enough brain matter in his medical career.
What about the fact that he basically tossed him to cool out in the snow?
His feet were so blue and had bruises on it. For why? There's no blood left. They drained him, right? They drained him like a stuck pig. So technically he shouldn't have any blood or anything like that left. And I think the cooling part is at that point is not more for evidence preservation. It's more we ran out of room in the freezer. And this is a town that doesn't have a coroner or a funeral home.
Coroner I can buy because it seems like it's a boom and bust ski town.
Funeral home?
Funeral home, though, yeah.
Right? Like, funeral homes definitely have freezers. For a fact. So, I don't know why they stashed them in the back in the pile of snow.
No, they stashed them in the back because an alien was the guy who was in charge of that.
Yes, but still. Who moved the body? Was it just the alien? So, he's the only one who did it?
Yeah.
How did no one else notice feet hanging out of a pile of snow?
Pass.
I'm poking holes through this show. It was a weird, fun show, but I am, like I said, I watched this from medical doctor land, and my brain is sad. My brain real sad. Also from missing going to bars and whatnot. The bar scene made no sense to me too, because that is a type of bar that does not play Nicki Minaj. 100%. There's no way a coal miner bar would play music like that. Or was it coal mine? I don't know what kind of mine it was.
The town history was coal mining, but I think it's now a resort town.
Okay.
Slightly out of resort season, because they were saying that in a week. I think they said that in episode 2, that as soon as they get a good rain, all the snow's gone.
Fair. So all of that, not cool. There was one more scene in the first episode that kind of drove me nuts too, which was the fight between like his assistant Asta, or I don't know what her name. Asta and her ex-husband, I guess. Mm-hmm. The one thing I noticed was, so they kept jumping back 4 months ago to today, right? She has the same cut on her lip from 4 months ago that she does today. Like, she always gets punched in the left lower lip constantly. But she also suffers from the standard trope of fight injuries, right? So if you are in a fight, you have 2 injuries always. It is a busted lip and a bloody nose. Mm-hmm. There is never other injuries that ever present itself.
Except for a black eye.
Rarely, though. Because they can never make the black eye look real enough, so people try to avoid using a black eye. Mm-hmm. And she always gets punched there. But again, if you got punched in the mouth, I expect more blood, right? Mm-hmm. Like, she should have at least a broken. And also, if you got punched in the face hard enough that you got a bloody nose, I'm worried about a broken nose. So more swollen face, all that stuff. My standard complaint. Yeah, my standard complaint
from the broken nose.
You could, yeah. Because that's usually from like a base or a skull fracture, so you get like the raccoon eyes. Mm-hmm. I don't. This whole sorry, that whole scene just broke me a little bit. I was expecting more blood, which is always my complaint, but that's where I'm at.
As far as let's go with what's the premise of the show is, though. Mm-hmm. As far as a random guy who just basically watched YouTube videos doing an autopsy, how did he do?
So actually, when he first started, he was cutting at the neck first to go down, which is bad. Mm-hmm. I would say, and there are actually videos of how to do an autopsy on YouTube. I found those. It's there. He did not follow all the stuff that he was supposed to follow. I mean, there was the whole him weighing each organ and whatnot, and then he sniffed a lot of stuff. But I wouldn't say he did like that great of a job in general. And also, those are cases where sometimes we'll have patients go through a CT scanner too to make sure there's no other occult injuries before we cut them open.
Occult injuries like ghosts.
Yes, that kind. Or the ones that we can't see clearly right off the bat.
Like vampires.
No. Vampires only through mirrors.
Okay.
Yeah.
Do vampires show up on CT scans?
I would think physically it should be fine because you're shooting radioactive beams. Or X-rays, I guess. So it still bounces off stuff.
It's not a reflection.
Yeah.
Okay.
I don't think there's mirrors in CT scanners. But now I'm trying to remember. Oh, man. I'm not a radiologist, so I'm not 100% sure.
Now I'm thinking, is Monica a vampire in WandaVision? Because she's clear on that CT scan.
So that wasn't even a CT scanner. So what they used in WandaVision was an X-ray. That was it. That was an X-ray box that they called a CT scanner. Yes.
Okay.
Yeah. And then the picture that they took was an overexposed X-ray is what it looked like to me. So there's your WandaVision
bonus
piece.
Content.
Yeah, there's your WandaVision piece for this week. But I'm not here to talk about WandaVision. I'm here to talk about Resident Alien. Episode 1 of Resident Alien, very tough.
Okay.
Episode 2, oof.
Yeah, episode 2 is a little bit more lighthearted. We're just going to talk about the day in the life of Harry the Alien, who has taken over the practice of Sam because
why not?
Because why not? Because that's good television.
I mean, they need a doctor, right? So let's just find one person who is on vacation and then I don't think he was on vacation. He said he lived there.
So the real Harry spent a week there every year fishing, and in the very first scene, the sheriff and the deputy were saying, "Oh, so and he's been here since? Did he retire or?" And they didn't really answer it.
Fair enough.
But basically, what happened is real Harry was out there fishing for a week, ran into the alien. Alien ate him, body snatchered him.
Yeah.
And
now we're where we're at.
And now we're where we're at. And where we're at is Harry doing a day in the life of a small town doctor?
I'm confused what kind of practice this is, because it looks like primary care, but there's also an ambulance bay drop-off.
But it's also a ski town.
True, but it
might also be like the ski clinic, like the clinic that they'd send someone that was beyond first aid of, needing a bone set or something like that.
Fair. Also, bone setting is definitely not first aid.
Right. Yeah, that's what I mean. Like beyond what they could do, like at the resort itself.
Yeah, I was just really confused in general about that whole thing. And then it opens up with a kid in the exam room by himself, which was the only kid that can recognize he's an alien, I guess. So he's going to sixth sense him the whole series, I'm guessing. But it's really rare, if ever, for me as a doctor to examine someone underage by themselves without a chaperone. And I think that's a general rule that we have. If you're going to do anything invasive or you don't have any witnesses, get a witness. So I was surprised that they didn't have like a nurse in the room with the kid by themselves. I don't care how savvy or how, oh God, that kid is a mouthy kid. How mouthy this child is. You don't leave a minor unaccompanied in a clinic that needs to get examined. Because it's like asking a 5-year-old, hey, why'd you come to the doctor's office today? And the first thing he goes, I don't know. My mom took me here. You're not going to get any kind of history or help from that at all.
And in this scene, he was just there because he had a sore throat.
Yeah, he's not going to tell you that.
Even if he doesn't think you're an alien.
Correct. He'll be like, I don't know. So this is usually when I play the game with kids. I go, does this hurt? And I'll touch them on the shoulder. And they're like, yes. And if that's their chief complaint, like let's say their shoulder hurt. I'll touch their shoulder. They're like, does that hurt? Yes. Does this hurt? And I'll hold their hair. They say yes. And they go, immediately, unreliable narrator. And then I have to kind of rely on whether or not they wince if I touch them or anything like that. So this is one of those situations where I would not trust a kid by themselves. But then they showed other things like a cryotherapy needle or whatever to freeze off warts.
Yeah.
That's I would expect a clinic of this magnitude not to use something like that.
Right. So after Max, who's the kid who can see Harry, escapes out the window, the next patient that Harry thinks he's seeing is a 12-year-old boy with a
wart
near with a wart in the groin area.
Oof. Yeah. Do you know how we treat it? Do you want to guess?
It's going to go away?
No. So there's two ways.
You cut it out?
Cutting it out. So a wart's caused by a virus.
Okay.
And the more
also antibiotics.
No, viruses do not respond to antibiotics.
Wow.
Shame on you.
Really
Shame
bad
on you.
This.
Bad.
I'm fired.
You're out. Get out. No, but so the thing with the warts is the more you pick at it or you claw at it or you try to excise it without doing it completely, the more it grows back. So we freeze it. And we need to use something super, super cold. So we use liquid nitrogen. So when I was a resident, we used to have this whole bucket of liquid nitrogen in a back room. We'd fill up a cup and then throw in a bunch of Q-tips in there and just let it get super, super cold and hard. And then we would just take the Q-tips out and press it onto the wart until it froze. And they got a nice burn. And then we would be done.
Oh, wow.
And then eventually it would fall off. And then in my residency, when I had to rotate through the free clinic and we had to deal with warts in different, more sensitive areas, we would have a gun of liquid nitrogen. So it's like a super soaker that was filled with liquid nitrogen, and we would spray it right onto the offending lesion.
See, that needs to be on TV somewhere.
What, using a super soaker gun?
Yeah, the super soaker wart therapy.
It was like I'm trying to think what a good equivalent thing would be like.
It'd be like a super soaker filled with liquid nitrogen.
I mean, it's not like, I know in your head you're thinking like I'm pumping it with a bunch of
I'm thinking like proton pack.
Yeah.
You're going in with the backpack on.
But really, it's almost like those whipped cream canisters kind of situation where you fill up a whole canister with liquid nitrogen and it has a very narrow nozzle and you just kind of shoot warts. 3
medical students died when they confused their whippets for liquid nitrogen.
Oh, you would know it's liquid nitrogen. That thing is cold as hell. But I remembered using said liquid nitrogen super soaker on people, and it was just screams, and those screams haunt me to this day. So that's how you would treat, and they were in the groin area or in other areas down there, and it is not fun to deal with. And yeah, I would not use like a cryotherapy needle or whatever like that, because those don't work really well. They don't get cold enough, and you really need to kill those viruses to the point where the tissue around it is inhospitable and it falls off. So yeah, there's your medical lesson of the day. You treat warts with a super soaker of liquid nitrogen.
This podcast is not medical advice for anyone who has a squirt gun and liquid nitrogen lying around.
It's not going to hold in the squirt gun either. Everything's going to jam up. It's not going to work. I'm telling you right now. Super soakers aren't meant to handle that much cold. Can't.
Yet.
Unless it's a metal one. But then are we really dealing with super soaker at that time? Also, do you really want someone aiming at your wart with a super soaker? Ugh. No thanks. But all of the talk about warts was misguided, I guess, because that was not the patient that showed up.
Right. That's, I guess, question number one is how likely is it, I mean, with Harry's level of incompetence, how likely is it for him to walk in with the wrong patient's chart and for that sort of mix up to happen?
I do that a lot.
Okay.
Like, it's not an uncommon thing where we would expect to see one patient in the room and then it's a totally different patient. Mm-hmm. Sometimes when staff bring back patients and put them in the wrong room, and then in the emergency department especially, like the tracking board is off and the patients got switched, and you walk in and you talk to them and they look at you like you're the dumbest person in the world because this doesn't correlate. You're like, oh crap, I'm in the wrong room. So this happens constantly.
I'm sorry, doctor, my shoulder doesn't hurt. It's my hair.
Yeah.
What are you talking about?
Exactly. And though some parents are really, or some families and patients are really polite and they kind of go with it for a while, others will not. So it is a surprisingly not uncommon thing to happen.
Would you rather, as a doctor, have the family who is polite and will go with it, or the family who will be like, no, that's not why we're here?
No, I'd rather be stopped. I want my reign of terror to end in that case, and I want to be able to actually be a real doctor that's competent and treat what's wrong than appease and be polite in that situation. I want to know that I messed up so that I can actually do the right thing and help you out as a doctor instead of living in my fantasy world that you have nothing wrong with you. So that's a big thing. It. But also, I would not confuse a 12-year-old boy with a aged woman.
Yeah.
So that woman coming in for a pelvic exam, that was highly inappropriate what was going on. Right. There. You can set up that one.
So so he thinks he's going to do the wart treatment. Turns out it's a adult woman who's in for a pelvic exam. And he gets his head under a blanket right in there. Yeah. Starts Googling how to do it and accidentally takes a picture.
Yeah. So this is one of those situations that has red flags all over it. Especially as a male physician going in to do a gynecological procedure, I would make sure to have a chaperone with me at all times. And it's not just for my safety, it's also for the patient's safety too. Because you don't know what kind of person this is and what kind of stories they're going to make up. And this has happened to colleagues of mine before too, where families or patients would accuse the caretaker of doing something completely inappropriate that they never did, but there's no witnesses. So it's her word versus their word. So in any situation where there's a procedure like this being done, I always make sure to have a second set of eyes to make sure that there's no funny business going on. The blanket over her lap is just a hindrance. Let's just put it that way. Usually we lift up the gown and all that stuff, and we explain everything step by step. Like, you're going to feel the back of my hand on the inside of your thigh. And then you're going to feel my fingers wherever I'm going next, and kind of explaining things step by step and going through the whole procedure. Funny thing about that is, in medical school, we did have a medical student at that time who did leave the blanket over his head. and it gets really warm. So warm to the fact that he forgot to breathe very well.
Oh, I don't know if that's come up on the podcast or just over drinks, but yeah, I remember this story now.
And he passed out straight in, face first, into that area. So, you want to make sure the situation's right. And especially I think this was second year of medical school, and he passed out straight into her, just downstairs right away. And he was out for a little bit.
If you're a medical student and listening to this, don't lock your knees.
He was sitting. Also, here's the thing. If you're doing a pelvic exam standing, you're doing it wrong. Okay? 100% you are doing it wrong. Fair. Unless you're trying to do a bimanual, which is trying to make sure there's no cervical motion tenderness and all that stuff, then standing up might be a little more comfortable, depending on the situation. Usually you're sitting. This kid was sitting. I say kid. He's an adult, but he was sitting. Thing over his head, freaked out. I mean, there was a lot of laughter for a while. I don't think any amount of drinks will erase that from anyone's memory. But it is a story that lives in infamy forever. Don't be the one that passes out for a standardized patient. Thank God it was a standardized patient and not a real patient.
Standardized is meaning a training situation?
Practice patient.
Practice patient.
Yeah. Someone who gets paid to do this. Who would, thank you, standardized patients, but I could never let that happen. Or there's never
she got hazard pay.
Clearly there's a lot of hazards here, and you're hoping everyone cut their nails and all that other stuff too. Yep, that's right. I brought that up. But going back to this episode, this is one of those highly inappropriate patients that you have red flags when you walk into the room, and you need backup right away. There's no way I would be comfortable with a patient like this by myself. No way. Mm-hmm. And also, especially breaking out a cell phone and with flashes, lawsuit, guaranteed.
Yeah,
right away. Oh, and then you watched one more episode than I have, so I can't really explain why the hell is there such a large freaking circumcision poster in this clinic.
Circumcision becomes a plot point in episode 3.
I don't want to know why. I really don't. Also, it's one of those posters, I get it. You want it to look like a clinic on TV, right? So you find whatever clinical posters you can find and put it up. That's why you always see that one poster of the human body or whatever that looks like every other poster of the human body that has the same
Mr.
exact
Good
font.
Body poster.
Almost, yeah, but it has the same font and everything.
There's the one that it's half typewriter and half handwritten.
Yeah, and then the other one was big blocky letters that say the human body with serifs and all that stuff. I see it all the time in every single show I've watched, where it's the skeleton and then there's the muscles overlaid on the skeleton on the other half.
Mm-hmm. Oh, okay.
It's one of those where you'll see, you're that's the poster he's talking about. It's always on there. My pediatric clinic when I was growing up had the Bristol stool scale. And I don't know why that poster stands out in my head now. And it's kind of ironic because I deal with that Bristol stool scale way too much in my daily career.
So would you say it was formative for you?
I'm breathing very heavily because 4 out of 6 things on the Bristol stool scale are not formative. Technically 5. But yes, it was formative in my career. And I really hate that you made that joke. I don't know if you meant to do it, but
I did.
Oh God, that was terrible. I'm reeling right now from that horrible joke, and it worked so well. You bastard! I hate you. That was terrible. I gotta put up that poster somewhere if I ever end up doing a consultation on the show. That is a poster I'm gonna find to put up for sure.
Nice.
But yeah, I'm really scared why this circumcision poster is there now.
It's Chekhov's circumcision.
Oh God, I feel like this is not going to end well, and someone's going to get a hoodie.
You don't put a circumcision poster in episode 2 if you're not going to have a circumcision in episode 3.
Oh God, please, for that kid's sake, that he ends up okay. I really hope he ends up okay.
The kid's fine.
Okay, good. Speaking of kids who are not fine, that first kid in the episode comes back because he needs stitches after Harry cuts his brakes. That is the worst stitches scene I've seen in a long time.
Yeah. So the scene is basically Harry's nemesis is like a 10-year-old boy who can see him.
He's a mouthy child.
And Harry tries to kill him by cutting the kid's brake lines, but it's on a bike, so he just doesn't make it down his driveway before he falls down.
Yeah.
And has to get stitches. Harry thinks he was going to die. In order to properly be menacing, when the kid won't cooperate and say, okay, I'm on Team Harry now, Harry gives him his stitches without anesthetic.
Yeah, and even before all of that, the nurse was in the room loading his needle into the bad needle driver. I usually don't have them opening up anything before I do that procedure. You want to load the needle yourself because it's going to be one of those like nitpicky things. So a needle itself is pretty curved, and some people like having the needle.
When you say the needle, you mean the needle for the stitches and
Correct.
not the hypodermic needle.
Correct. So usually I want the needle driver to be at a certain point on the curved needle attached to the sutures to go in. So I usually do all that stuff myself. But also, if you open up that packaging early,
it's going to be less sterile.
Not so much less sterile, but there's certain sutures that are soaked in a solution to keep it wet. And the minute it dries out, it becomes really brittle and it just falls apart. So
are those like the kind of stitches that are designed to
dissolve,
be like dissolving?
Absorbable sutures, yeah. The other thing I noticed too is they're using the wrong kind of needle driver. So
what is a needle driver?
So a needle driver is what you use to hold the needle to do stitches or to drive the needle into your skin, which sounds
because
worse.
It's not like hemming a pair of pants where you're just holding the needle itself.
Correct. So we use like the needle driver to actually guide it through, and we usually use a straight one because you can kind of tell where things are going with a straight one. You don't want to use a curved one unless that's the only thing you have left, because the curved one kind of affects the angle you attack. And because it affects the angle you attack, you might not be able to approximate the skin well.
Wait, if you don't want to use it that often, then why does it exist?
Sometimes it helps as a clamp. So like clamp blood vessels. Sometimes you can use it as like a counter attraction kind of situation.
Okay, so it's not a one-use tool.
No, it's like other things too. But usually we call those hemostats. And hemostats are used to like clamp things usually too. But for me personally, I never use those. And even my plastic surgeons never use the curved hemostats. They always use the needle drivers that are flat. So that's like one big thing. The other thing Harry said was good boys get Novocaine. Bad boys
is not what they'd be using, right?
Correct. We use lidocaine or bupivacaine. So lidocaine is, your standard numbing medicine. Bupivacaine can last a little longer too. So we'll actually have patients that will need a mix of both because it helps them last through the procedure longer, especially if they have like a significant amount of sutures.
I'm probably one of those patients. I've got redhead syndrome.
Oh yeah, you got the weak pain.
Yeah, like it just wears off.
You'll wuss.
Yeah, there's that.
But even now, like especially for kids, we try to avoid injecting lidocaine if we can avoid it. So we actually have like ointments or solutions that we can actually soak into a sponge and put it onto a cut like that, and it'll do the same thing. But you would imagine this is a cut that's relatively fresh, right? He didn't wash it. It's not bloody enough. And you would think if a kid fell down and on asphalt and he ground his
there'd
arm,
be
gunk.
There'd be asphalt.
Yeah, so you should probably clean it out. So maybe,
or he shouldn't, but we should see that it was gross and gunky.
My theory is that Harry's just trying to kill him by sepsis.
Or that's just a bonus effect. We haven't seen episode 4 yet.
He might die of an infected wound, and I can't wait. That kid is mouthy. He is too mouthy. He is annoying. I know, saying that from a pediatric emergency medicine doctor's standpoint, that's bad. But that kid is not, I know he's supposed to be like this, I don't know if he's supposed to be likable. He's supposed to be like our eyes, right? He's the representative.
Supposed to be like Kevin McAllister likable.
So not likable.
Right, but he has to be a certain level of savvy in order to be a foil.
He's slowly crossing over to problem kid situation. Or problem child. I forgot the name of that movie. Problem child?
Problem child.
Yeah, he's crossing over to problem child territory. So it's a very fine line for them to walk, but they're tipping over the not fun part.
So the scale goes Home Alone, Problem Child, The Good Son, The Omen.
You know what? That's
I guess Sixth Sense would be the good side of things.
Yeah, for sure. Like, because Sixth Sense, he was just trying to help, but he wasn't mouthy. He saw dead people and was a little whiny, but other than that, he wasn't like annoying. So that would be my whole selling point. But I'm gonna bring it up to just the last thing. I think for me personally, the last thing I want to talk about this episode is man getting hit by bowling ball. Mm-hmm. I mean, a good groin shot's always funny. However, I don't care how tough this cop is, he's not getting up. No way.
Yeah.
You're making like the cringe face on this.
No, I'm trying to think of, okay, well, what if it was just a glancing blow? No.
That is a strike. Mm-hmm. That is 100% a strike. So he's at higher risk for like testicular rupture and all that stuff too. Or at least a testicular hematoma.
Can't we just have one episode where we don't talk about testicular ruptures?
No. We're going to talk about ball injury if it shows up in an episode, you damn straight we're going to talk about testicular injuries for sure.
B is for broken ball.
You know what? I think so. In this situation, he doesn't have broken ball. There is no way he walks away from there, or at least walks away normally. He walked away pretty normally. Mm-hmm. He did not hobble. And I get that he's trying to act tough because he's like this big, tough sheriff. I did not like his character. I did not care for his character. But I'm glad he got hit in the groin. I was. He was like the Jesus. Didn't he give you the Jesus vibes? He had a costume to go bowl.
Yeah, he did. And the glove.
He had weight. And also, if I'm going to judge their bowling, too many straight bowlers. They all went straight down the middle. None of them hooked. Mm-hmm. And for a guy who has his own costume and gloves, you'd expect him to bowl with a hook. Just saying. I need to go bowling. I miss going bowling so much. I haven't gone for like 3 years, and I really want to go bowling again.
Kind of general question.
Yeah.
So, obviously, Harry is a doctor who does not have a good bedside manner because he is literally an alien.
You know, this could be the origin story of the good doctor.
That's where I was going to go with this. Would you rather work with Harry, or would you rather work with the good doctor? Or would you rather, like, Harry, good doctor, resident? Which one do you want?
Why do you hate me? Why must you put me through this stuff? Okay, so definitely not Harry, right?
Because he actively wants to kill his patients.
But not just that, he is actually the most incompetent of all the patients. Mm-hmm. Right? I don't care how smart he thinks he is compared to all humans. He is actively the most incompetent doctor of all of them. Second to the most incompetent would be the resident, who is also very incompetent. But if I need a surgeon, I'll have the good doctor do all that stuff. I don't think he's a good primary care doctor, but also the resident is also not a good primary care doctor. I don't think there is a show that I can think of off the top of my head other than Heart of Dixie, which is a terrible CW show where it features prominently a primary care practice.
Who's good at it?
Ooh, then I should take back the Heart of Dixie. Because she was I think she was supposed to be an ER doctor who moved to a small town and became a primary care doctor. I hate that I know that because I did a lot of research on medical shows in general. But I can't think of any shows that are based on primary care doctors right now. And it's kind of sad, but it's because there's not a lot of drama in primary care, right?
What was Cliff Huxtable?
He was a psychologist.
Was he? Okay.
I believe so. Also a diddler, but mainly a psychologist.
Yeah, also not a good doctor.
Correct. But yeah, I don't think there is like a doctor I can think of that was like, oh, I had a rough day in the clinic today. Not in the hospital.
I'm sure there's a sitcom that we're not thinking of.
Dr. Ken, maybe. Dr. Ken might be the closest thing to like primary care.
What was Ken Jeong's specialty?
Internal medicine.
Internal?
But internal medicine people work in clinics a lot of the time too. So he might be the only primary care physician that I can think of in terms of television, at least at this point. If you think of something else, call us at 530-DOCTORB.
Yeah.
But yeah.
With that, I do have a question.
Bring it.
the human centipede bills itself as 100% medically accurate. If that's the case, and if that's our baseline, how medically accurate are episodes 1 and 2 of Resident Alien, airing Wednesdays on Syfy?
Excellent plug there. So I'm actually going through my list of medical accuracy things that we've covered recently, and I believe The Simpsons was like 65%.
The one we did last week
that we just did. It's about that level. The medicine is not great, and also just the portrayal of how he is a doctor is bad. You know, like, I get it. You're a small town doctor. You're so laid back. You wear flannel, and then you wear a white coat over said flannel. So laid back. Doesn't change how you practice medicine, though. And it shouldn't. But the whole, like, gyne exam, that was kind of weird. Doing stitches on the kid to torture him, that was not cool. And it didn't look real, too. And then the whole overarching story of the doctor stabbing himself in the throat to help himself breathe, I don't get that part at all. Like, I'm trying to think, like, if I can't breathe, what are the steps I'm going to try to do to help myself breathe? Like, if I think I'm choking, I'm going to throw myself on the back of a chair to try to Heimlich myself.
You're going to Liz Lemon it.
Yes. And it works. That's actually a thing you're supposed to do. I'm not going to blind sweep my throat, but I see where people panic and they put their fingers in their throat trying to clear whatever's in there. But that's how you push stuff deeper. Last case scenario would be that. But even then, I wouldn't stab myself repeatedly in the throat. I would try to stay calm as much as possible and remember what I was taught on how to do a tracheotomy. And I get, you might be thinking to yourselves, people at home, like, this is a primary care doctor. How would he know how to do a tracheotomy? There's so many TV shows that show people doing it. And even as simple as taking a pen, stabbing it into your throat, and then opening the pen up, and then thus giving you a hole to continually breathe through. That's what you're supposed to do. Like, if you stab yourself in the neck with a scalpel and then you take it out, the first thing that hole does is just close up. Yeah. So you want something to keep it open the whole time. You can't just put your finger in there, because now your finger is plugging the hole. Like, you need something like a hole, like a pen or something like that. So
long before you and I knew each other, my wife and I were out with one of our friends who was in his first year of med school. And we'd gone someplace that had fishbowl drinks and big honking straws for them, and he was carrying it around the rest of the night, ready for that emergency trach.
I love fishbowl drinks.
Yes, you do.
That was probably one of the first times we hung out. Like, you know that fishbowl drink is for more than one person? It's for 4 people. I'm like, I know. Yeah, holding a giant straw from a big old tiki drink, probably not the best thing to use to put into someone's throat. But hey, if you need something to keep the hole open, sure.
It was emergency trach, not, scheduled trach.
You know what, though? And this is going to be kind of physicsy. The longer the tube, the more dead air there is. So it's not going to help you ventilate as well.
But you could cut the tube.
You could, but I'm just saying, if he's carrying around the long tiki straw tubes, or tiki straw, long tiki straws, you have to make sure you cut it. It's the same reason why you can't put a garden hose.
Not medical or bartending advice.
Correct. But it's the same reason why you can't hold a garden hose at the bottom of the pool and use that to breathe. Right.
Not scuba diving advice.
Correct.
I guess that's snorkeling. It's snorkeling.
Yeah.
There's no scuba. Scuba's the tank.
Yeah, that's true. It's not self-contained.
Yeah.
It is a long snorkel, but that's the reason why that doesn't work either. There's so much dead air that you're going to just rebreathe the same air over and over again. So you got to make sure you cut that straw to make sure they ventilate well. But yeah, I know what you're going to ask next is, how am I going to fix this to make it more medically accurate?
Yeah.
He gets arrested after the first episode. The end.
For practicing medicine without a license in the state of Colorado.
Correct. Also more blood. Oh, no. Also, honestly, if you want to make it more accurate, you have him try to apply for a medical license, and it takes 8 months. That's the true accurate thing. Oh, we can't accept this. This is a photocopy of your diploma. We want the real diploma. Wait, you want me to send you my real diploma? Yes. Am I going to get it back? Maybe. So if you lose it, do I have to ask for a new diploma from my medical school? Yes. Are you liable? Are you going to pay me for it? No. That's real life. I say this with a little bit of PTSD.
Because how did you have to reorder your diploma?
No. I actually waited for them to do a clinic. I'm like, I'm not going to send you my diploma. Like, I don't know if you're going to do this. And I kept talking over and over again, like, are you going to lose it? They're like, no, we're not going to lose it. I'm like, I'm just going to wait until you guys come down from Sacramento to my residency to photocopy my diploma in person so you know it's real, so I know you don't lose it. Like, you're being paranoid. I'm like, I'm not being paranoid. That thing's an expensive piece of paper. I don't want to lose it. I'm not going to send it by certified mail if you're not going to reimburse me. I'm a broke resident. Please, please don't lose my diploma. So that is part of it. And also the extensive fingerprinting. That's also a part of it too. I assume that this alien cannot replicate fingerprints well.
He can.
Has it been brought up?
Kind of.
They definitely have a medical consultant then. Because these are all real things. Like clerical stuff that gets brought up. Someone had to have gone through it to know that this is
like the clerical stuff. No, the fingerprinting doesn't come up like to that extent, but the
background check live scans
in the next episode, which is probably going to air the day after we release this, but is already available on Syfy.com. They find the real Harry's foot in the water.
Gross, super gross.
It's gross.
Yeah.
All right.
Watch it if you like weird sci-fi. Don't watch it if you want a medical show. That is how I'm gonna sell it.
I really like this show, and I'm kind of bummed that it's not easily streamable other than the first few episodes.
God, it took me forever to find it. So I was on the NBC app. Mm-hmm. It's on Syfy app, both with an exorbitant amount of commercials that I did not appreciate.
I got so many commercials for Resident Alien while watching Resident Alien.
I had commercials for CBS All Access on NBC, and that was very confusing to me.
That's weird.
The other thing, it wasn't on Peacock or anything.
It's not on Peacock. They've got this brand new streaming service that they're pushing out everywhere.
You can watch it on demand. So if you have cable, that's probably one way to go too. But otherwise, it's a little tough of a show to find, I would say. So
I feel like that's kind of been the problem with sci-fi shows. Sci-fi channel shows in general.
You mean like Winona Earp?
Well, like Winona Earp, like The Expanse before it moved to Amazon, like The Magicians, is that they've done some really good new shows in the past 6 years. But they're really hard to watch if you're not someone who has cable.
Yeah, and especially this year with no Comic-Con, they can't do their normal media blitz that they normally would do. Syfy has a massive presence at Comic-Con, and that's like one thing that they couldn't do this year. But yeah.
Hopefully, in the future, sci-fi stuff will be on Peacock, and I think that will be a boon for the genre.
Yeah.
Because I think that there are shows that haven't gotten the attention they deserve because of the fact that they aren't easily streamable. And by the time they hit Netflix, a quarter of the people have seen it and the other. And so it doesn't get the same traction.
Like Peacock bought WWE Network, so they can totally afford to put Syfy on there.
I didn't know that.
Yep, for $1 billion.
Dang.
Yep. Random fact for you to go out on right there.
Yep. All right. Well, thank you, Jackson, for joining us. Thanks, everyone, for listening. If you enjoyed the show and you've made it this far, best thing you can do is tell someone about the show. We're steadily growing and really appreciate it. But word of mouth is how people hear about podcasts. So if you tell one person about this podcast, we would really appreciate it.
Yes, we would. Thank you so much for listening to us. We'll see you next week. Bye.